blackening and surgery of the second toe about a week back. This patient is an elderly lady, and she used to walk, but there is no history of any trauma, any injury to the foot, or any previous disease. Especially she does not have इनको दिल की कोई बीमारी थी पहले ना था कोई दिल की कोई she has no cardiac complaints in the past, and she is non-diabetic, she is not hypertensive. This story started that she was having one previous episode of pain in the toe on the left side, and there was some blackening also, but that healed about 6 months back. Now this swelling in the lower limb started on the right side, right foot, about a month back, and the blackening started about a week back, and one of the toes became completely gangrenous, and she consulted a local doctor in that area, and who amputated that about 5 days back. Now following that, the disease did not stop, and it continued to progress and involve the proximal part of the dorsum of the foot. So she was advised to visit the medical college here because of this blackening, which is gradually going upwards. So now whenever you have a patient like this, first of all, the age is very important. Now in those patients where the age is about more than 50 years of age, most of the time there is age is about more than 50 years of age. Most of the time there is cardiac diseases, and these cardiac diseases, they give rise to various complications, and one of the complications is the thromboembolic episodes, and that leads to sometimes the thrombus getting impacted in a distal vessel of the lower limb, and that can cause changes in the limb, and then can cause gangrene, and also some changes in the skin of that particular area. So now this patient has only one history, generally blackening and color change of the limb with an ulceration and gangrene of the foot. This is a typical disease of an arterial disease. Now the presentation of arterial disease is two types. One is intermittent claudication, in which there is pain in the calf muscles initially, and if the claudication is at a higher level, then it is the thigh muscles and also the gluteal muscles. So intermittent claudication is, what is intermittent claudication? Pain during walking and relief on rest. So if the patient has intermittent claudication, that is the first sign of vascular compromise. So if any patient who is a chronic smoker, or who has diabetes mellitus, or who has some exposure to cold, or who has some cardiac disease with sudden change in the lower limb, so all these 4 or 5 categories of patients, if they complain of pain in the calf muscles, and DVT is also one of those, deep vein thrombosis. So that is of course a venous disease. But what we are talking today is about an arterial disease. So this arterial disease is mainly, it starts in a distal vessel. So distal vessel means below the femoral and popliteal. Below the popliteal there is bifurcation of the vessel, anterior tibial and posterior tibial. So these are the most distal vessels, and if there is a thrombus which comes from the aorta or it comes from the cardiac, that thrombus may go and lodge in that particular vessel and will block that vessel, and hence the vascular supply of that limb will be compromised. So in this type of patient where the age is 90 years, that is the most likely possibility. Here, presentation of intermittent claudication would not be there. This is a sudden onset of pain and blackening. That means acute onset disease. So that acute onset disease occurs in two conditions. One is subacute bacterial endocarditis. The other is acute myocardial infarction or any other aortic condition in which there is some change which leads to thrombus formation, especially if the patient is having hypertension. The long-standing hypertension will lead to having small thrombi, and these thrombi, they move and go and clog the vessel, which is dorsalis pedis or posterior tibial or anterior tibial. So any of these vessels, if they are blocked because of a sudden onset, and the presentation is acute onset of pain and swelling and blackening. Initially the blackening is mild, but gradually it becomes dark black and the tissues become black. So now with this history, there is no history of hypertension, there is no history of cardiac disease. Of course, she is from a village and where all the facilities for consultation with the doctors is not there, and maybe she has not consulted. She may be having all these conditions. So that is why we have to assess the patient, whether the patient is having any pre-existing cardiac disease or pre-existing diabetes or pre-existing any other disease in which there is a compromise of the vasculature. So now before we do the local examination, we must take her blood pressure. Of course, the vital signs: pulse, blood pressure, temperature, respiratory rate. Blood pressure is very important because if she is hypertensive, then definitely this could be one of the etiologic factors which has resulted in the blackening of the lower limb. Then she needs to be assessed for all the distal vessels. So the first distal vessel, of course, we like to see the upper limb vessels. The pulsations are equal on both sides and it is normal pulsation. So there is no compromise of the vessels in the upper limb. Then now we like to see the vessels of the lower limb. So there are three vessels which are important in this type of presentation. One is the dorsalis pedis and posterior tibial, they are together. Second is the femoral, the popliteal, and third is the femoral. So these two vessels have to be compared, whether they are feeble or they are equal, or one is more and one is less. So we are trying to palpate the dorsalis pedis, and this is how we palpate the dorsalis pedis. First we are trying to palpate the normal side. So it's about 1.5 centimeters distal to the this joint and lateral to the tendon of extensor hallucis longus. I am unable to palpate the dorsalis pedis. Maybe it is absent or maybe it's very feeble. So in this limb also there is some predisposing factor where a gangrene can take place. The other side, then the posterior tibial, again it is between the medial malleolus and the insertion of the muscle, and it is somewhere at this place. That is also not palpable. So the dorsalis pedis and posterior tibial, they are not palpable on that side, and of course not. There is also edema of this feet, and hence the examination will be more difficult. This is here where the palpation has to be done. This is how we palpate. We join the line between the two malleoli and then 1.5 centimeter distal to that and lateral to the tendon of extensor hallucis longus. I cannot feel any pulsation. So this dorsalis pedis is palpated like this, and in this case it is absent. Plus there is pitting edema also, and the posterior tibial is again here. and it is also absent. So there is absence of posterior tibial and absence of dorsalis pedis. For palpating the popliteal, we have to flex the knee and try to palpate here against the bone. This is also not palpable here because this is not the exact method. We have to make her sit down and then do the examination. So this is not palpable in this case. Modiye. So posterior tibial, dorsalis pedis, and now we will try to palpate the femoral, anterior scapular spine, pubic symphysis, midpoint of inguinal ligament, and 2 cm below. And you can see my finger. There is pulsations are present. So on the right side where the disease is, there is femoral pulsation. And the same would be on the other side because that is less diseased. Yes. So femoral on both the sides are palpable. Posterior tibial and dorsalis pedis absent. And below the knee also, all the pulsations are absent. Now coming to the local examination, we have to compare the temperature of the two limbs. So we start from the dorsum. It is bit colder on the right side. Somehow there is some elevated temperature also. That is because of inflammation in some places. This is how with the dorsum of the hand you see the normal side and then you see the disease side. There is no much difference at the upper level. Both are having equal temperature, but below the knee joint there is definitely decrease in the temperature. Now coming to the local examination, you can come closer and show the limb. So on inspection, you can see that there is edema of the right foot with blackening of the toes and the disease between the two digits, especially the first and second, and the second has been amputated. And this blackening is continuing on the posterior aspect also. Show them. So the whole right side of the limb is having blackening up to the dorsum and just about a centimeter from the two malleoli. There is blackening, and the blackening is more in the diseased area. Proximally also there is some skin changes. There are no hairs which are seen. Here on this side also there is no hair, although the hair is a marker that the blood supply is adequate. And of course the color change is extending up to the mid part of the leg. On the other side there is no specific color change, and here the toes, the second toe is absent, which has been amputated. The third toe is completely gangrenous. Fourth and fifth are also having gangrene, but not to that extent. So the disease is involving whole of the front dorsum of the leg with the toes and the posterior aspect, plantar aspect of the leg. Only the heel area is spared, whereas whole of the dorsum of the foot and the distal part of the toes, they are all blackened and gangrenous. अंगूठा चला के दिखाइए, ये अंगूठा चलाइए. There is functioning of the limbs and muscles. इस तरफ चलाइए. There is some function, but other toes are not moving. So there is loss of function, there is loss of temperature, and there is death of the tissue. So that is typical of a dry gangrene. So it is dry gangrene because there is no pus discharge, there is no any other issue which leads to seepage or secretions. So now what we have is a patient, elderly patient with sudden onset pain and swelling of the distal part of the limb, dorsum of the foot and the toes. For this she consulted a local practitioner who operated and removed the second toe, but the disease did not improve and she has been referred to us for diagnosis and for treatment. So the diagnosis in this case appears to be that it is a distal vessel disease involving the dorsum and the plantar aspect of the foot, and the most important cause in this case appears to be a thrombus. So for that we will need to first of all do the routine investigations, and of course in this case blood sugar is very important. Then Doppler examination. So Doppler examination, of course clinically it appears that the popliteal and beyond the popliteal on the whole on the right side and also partly on the left side, they are affected and is completely gone, and also the tissues are dead. So the only confirmation which we require is what is the upper extent of the disease. So clinically it appears to be just at the level of the bifurcation, that is at the popliteal level. So below the popliteal, the right limb has an absence of blood supply and there is also not much of collaterals. Otherwise there will be supply which will lead to some changes, but blackening is so dense that it appears that there is no collateral circulation. So now this is a dead limb, especially the dorsum of the foot and the toes. So now the only thing which requires is to know what is the extent and if we can salvage the limb in this case or not. So since the whole muscles are dead, plantar aspect of the toes is also gone, there is no risk, there is no chance of saving the distal part of the limbs, foot especially. However, there is some chance of salvaging the heel area and the proximal part of the limb, of the foot, and that has to be confirmed when we plan about the further treatment. Regarding overall assessment, we have to do an echocardiogram, we have to do an ECG to see for any cardiac ailment, and of course blood pressure and other things have to be monitored, and this patient needs to undergo an amputation of the distal part of the foot, and depending upon the etiology which we get after assessment, we will continue the treatment and we will see if it is hypertension, this has to be controlled. If it is diabetes, that has to be controlled. And any vascular surgery, if it is required, that can be done depending upon the type of vessel, the site of the vessel, but that will only be confirmed by a Doppler and examination of the distal limbs. Thank you very much.